Hello, my name is Cybele Renault, and in addition to being the rotation director for fellows and residents who rotate on the ID consult service at the Palo Alto VA, I'm also the internal medicine global health representative in our Center for Innovation in Global Health. The Center for Innovation in Global Health dates back to 2009 when Michelle Berry came to Stanford after spending about 30 years of her career at Yale. She's our Senior Associate Dean for Global Health. And with her, she brought the Johnson & Johnson Global Health Scholars Program, which was the first organized program in the United States to send residents, fellows, and faculty overseas to do clinical service for countries in need. The program has now been renamed the Stanford-Yale Global Health Scholars Program, but the principle is the same. These are fully funded 4 or 6 week rotations that are highly organized. And when I say highly organized, I mean that our trainees know the expectations. They know their role before they arrive. So that way they can make the most of their 4 or 6 week rotation. We currently have 7 overseas sites. Our sites are Uganda, Rwanda, South Africa, Zimbabwe, Colombia, Ecuador, and Borneo. We also have 2 domestic sites, both serving the Navajo Nation Reservation. These sites are in Chinle, Arizona, and Shiprock, New Mexico. Now, all of the sites are quite different, but I would say that the most ID-heavy sites are 4 sites in sub-Saharan Africa, so I'll tell you a bit about those. In Uganda, our trainees work at Mulago Hospital, which is in Uganda's capital city of Kampala, so an urban setting. And this is a primarily inpatient rotation. Now, the HIV prevalence of the patient population at Mulago is about 60%, and unfortunately, most of these patients have terminal AIDS. So this rotation is a true immersion into HIV medicine, where trainees care for patients with opportunistic infections and malignancies that we now infrequently see in the United States. In contrast, the South Africa site is in a rural setting. It's in Tugela Ferry, which is about 3 hours outside of the city of Durban. And this is mainly an outpatient rotation, where our trainees work alongside experts in the field of HIV and tuberculosis co-infection, really learning the nuances of drug selection, drug interactions, drug toxicities, while seeing incredible manifestations of tuberculosis in a highly immunocompromised patient population. Our rotations in Rwanda and Zimbabwe are similar to that at Mulago in Uganda, in that these are primarily inpatient rotations, in that the patient populations in Rwanda and Zimbabwe also have a relatively high HIV prevalence. These rotations overseas are opportunities for our fellows to take advantage of during their second year of fellowship or later during their fellowship. Also, for those of you interested in global health, our Center for Innovation in Global Health incorporates fields not only within the School of Medicine, but across campus, including the Department of Anthropology, the Law School, the Business School, the School of Engineering, really thinking about ways that Stanford can make the largest and most sustainable impact overseas. There are a number of different opportunities that our fellows can engage in terms of global health across campus, and these include lectures, not only didactics, but a series called Conversations in Global Health, where global health leaders in or outside of Stanford are interviewed. There's also a 2-day research retreat for global health that is led by CIGH's Director of Research, Dr. Stephen Luby. And lastly, there's the opportunity to take a 2-week intensive global health course, which I direct. And this course does not only focus on aspects of tropical medicine, but also, and even more so, emphasizes public health principles, global health economics, policy, and ethics. These opportunities further our fellows' experiences during their training at Stanford.